You're listening to Health is Membership, brought to you by MCAM Architecture and Design. My name's Zach Benedict. I'm an architect working in Northeast Indiana, and I'm sitting down with innovators across the care continuum to examine how we can redefine a culture of health throughout the Midwest. Here we will talk with physicians, economists, urbanists, politicians, poets, and everyone in between to highlight the specific problems facing our communities and consider the most effective ways to ensure their sustainability in the coming years. If you are interested in understanding the connection between health and place, you should know who Jane Ellery is. For years, her research has focused on collaborative change efforts, participatory approaches, and community-centered processes that aim to redefine effective placemaking. A longtime faculty member at Ball State University and a member of the Project for Public Spaces Leadership Council, her work has inspired numerous discussions about the future of community development and its responsibility to understand and appreciate how the built environment influences the social determinants of health. For her, I think these discussions are ways to process complex ideas and think through strategies more creatively. It's a passion that's infectious, and the reason we invited her to the show. Hello. How are you doing?
Hello. I'm good, thank you.
Thanks for doing this.
I'm excited to be here.
So I want to just jump right in. But I really wanted to spend some time, since we have your attention, to talk about framing any real concrete connection between placemaking and well-being. I think a lot of times we have these discussions about placemaking, but there seems to be only this casual connection between how we think about places and what the well-being or health of those places imposes on its users. Tell me how you think about the relationship between those two things.
I guess I'd like to start by just offering my definition of wellness.
Yeah,
please. And I've worked in a graduate program in wellness management, and I come from a public health background. I went from the medical model to this concept of well-being. And I didn't know what it was, but I learned that when I came to Ball State. And one of the theorists that I really like to look at his work is Halbert Dunn. And he's often considered the father of the modern wellness movement. And Halbert Dunn defined wellness as helping people function optimally in their current environments. So if we're going to help people become more well, we can do that by helping to grow people. And we can do that by changing the environments where they're in. So that's how I came to this connection between well-being and placemaking, is if we, as we're helping grow our people and we're helping them become the best version of themselves they can be, and we have them help create the environments where they are so they can continue to grow and expand within that environment, then it changes everything about how they function in the world and their emerging well-being.
One of the first times I remember, and correct me if I'm wrong, first time I remember really seeing someone make a direct correlation between these in a real public way was when Project for Public Spaces issued the Case for Healthy Places, the report. There was some work predating that, but to me that was this really happy moment for me that this was coming together in more of a mainstream way as these two things directly being connected. And then that report essentially got an update here recently. Tell me, and you've been involved in both, so really I'm curious about what it was like in developing, I think, that first real report for public consumption and how to narrow that down as best as you could. And what then has changed your thinking from when that was first issued to kind of the update now, which I think reads very differently.
It does for reasons that make sense. So if you think about that first report, what they did was they really looked at some of the characteristics of the social determinants of health, and they looked at some of the characteristics of place, not necessarily placemaking, but place itself. And they tried to find literature then that connected the two. And they ended up coming up with the 5 areas that were highlighted, like social and connectedness and green spaces and biking and walking. So there were 5 key themes that emerged from that. And then they went through and took those themes and gave some action items on how you could work within those. So it was really a report to just get people thinking that, wow, there is a connection between place and well-being and health. And there is action that you can take based on that. And most people have seen some of the data that suggests that your zip code is a better predictor of morbidity and mortality than your actual genetic code. So it was kind of fitting with all that and just trying to make an understanding of that connection. And that report came out in December of 2016. Interestingly, then, I took a sabbatical from the university from January of 17 through the summer, basically. And I worked with Project for Public Spaces, touting that report, talking about different things that came from it, giving presentations all over the country. And actually, I gave a couple outside of the country too, to really help showcase that connection. But as we step back and really try to expand on that and bringing my interests to it, I'm real interested in this concept that when you move from being I'm going to say a commodity or a consumer in a system where you're providing services to me, and you move into involvement within that system where you're allowed to be a maker or a producer in the system, then everything changes in how you interact with the world and how you feel about your place in the world. So one of the key things in that first report, it was the connection between health and place. What we wanted to do in this second report then was step back and actually use the placemaking process. So the act of being involved in creating the place to really set the stage for how involvement also has a connection with your health and well-being.
It almost felt like the first report was written in third person and the second report was in first person. Like the first group of recommendations had a lot to do with proximity, but the update it feels like it has a lot more to do with contribution, which
I like
is that
that.
fair? I mean,
that is fair.
They seemed very different in their approach, even though there is an overlap there.
Well, and I'm going to say too, what you read is really the academic report
Right.
for the second part. There is a report that's almost ready and hopefully is one of the pieces that I'll be able to help bring out because it's Project for Public Spaces is not going to be releasing it, but I'm hoping they've got a really nice, almost third person report based on this academic literature that will be out soon. So that's the difference between a designer marketer creating a piece and an academic creating a piece as well.
But do you think, what role do you think contribution plays in this discussion? Because I do think the first report had a lot more to do with physical adjacencies, the systemic creation and management of a place, but it didn't necessarily dwell on the realities of someone inhabiting a place and how they behave and feel. So talk to me more about this idea of contribution is the best word I can think of.
Yeah, I think contribution is a good word. I usually use involvement.
Okay.
How you're involved and interacting in a community. And I think that's probably kind of my focus. So coming from a public health background, I think about people first and place second. Whereas I think a lot of the earlier work was done by designers, especially architects and landscape architects, and they think about place first and people in that place. So it's probably a slightly different lens in we really focused on the person in the place and how they come to feel a sense of belonging or a sense of self or a sense of coherence in that place, which when you feel that is what allows you to be well in that you don't feel like you're being oppressed or ignored or any of those. So I think it really is about that person-place interaction is so key, and their involvement or their actions within that is a key part of that.
There's been a lot of research recently on um, the detriments of loneliness, uh, and it, kind of the opposite of what we're talking about here. But to hear you say there's uh, real benefit to this sense of belonging. It's kind of the antithesis of that. How do you measure something as fluid as a sense of belonging? What role does it play? How do you know it when you see it? What role does it play in this? And maybe more complicated, what impact does it have on our well-being?
So another one of my favorite academic theoretical folks is Aaron Antonovsky. And one of the terms that he talked about was salutogenesis. And if you think about salutogenesis as being the origins of health versus pathogenesis, which is really what our medical model is based off of, pathogenesis is the origins of disease. So as you think about the difference in those two terms, salutogenesis helps us think about a life worth living. Pathogenesis helps us think about a life where we keep from getting sick. And what you're going to do in those situations is a little different. And placemaking really fits into that life worth living. And we know in humans that worth living is also being connected to other people in ways. So as we create places, we want to make sure that we create places that encourage people to bump into each other. Fred Kemp from Project for Public Spaces said a lot of, serendipitously bump into your neighbors so you can create something new. And I think we don't give enough credit to that. We really need places where diverse views, diverse people, diverse ideas are milling around and they happen to bump into each other and enjoy a conversation. That's how we're going to change the world going forward. And that's how we're also going to eliminate a lot of this loneliness and isolation that we feel. A One of the most recent reports from the Harvard alumni study that's been going on for 70 plus years, Robert Waldinger is the current researcher looking at that, but they saw that if you look at people in their 40s and 50s, the only thing that predicts that they'll live into their 80s and become an octogenarian is the quality of their relationships.
Right?
So how do we create places where relationships are a key connector? And how do we bring the people who we want to have those relationships into the process of co-creating what that space looks like?
Well, the co-creation, I assume, is the key and the hardest part. It seems almost disingenuous to think you can fabricate impromptu interaction. You can nudge it. I've always said I think you can nudge it, but to think that you can control it or produce it without any sense of co-ownership of the actual individuals. So this idea of, what's the phrase? Tokenism,
Yes.
right? How that to me seems to be the complicated part. And I think up till maybe recently, uh, at least from a planning, design, professional services discussion, has been void of the discussion entirely. Academically, I think we've been flirting with this for a while, but from a professional standpoint, it's not even part of the discussion to even imagine that the users actually should be the ones in control.
And I think there's a continuum of participation. So once you move beyond tokenism, once you check the box.
What is tokenism, I guess?
Okay. So once you check the box that says, yes, we listened to the community, we brought them in, we heard their voice, check, that's tokenism. You have to move beyond that, where you say, wow, these people are the experts on their community. They really know a lot. We value what they know. We need to listen authentically to what they know. And there's this whole range that we can help create in this interaction that we're having with them. We can start with a professionally led, community focused process as we're helping them learn who they are and what's possible in these environments that they're talking about. But as we move through the process, we would love to be able to get, in some instances, to a community-led, professionally supported kind of role. So as you move past tokenism, there's that whole realm or continuum of involvement that depending upon the maturity of the relationships, depending upon the maturity of the space, um, you can work in a lot of different areas. One of the things that, again, I heard Fred Kent and his team talk about was how do you create a canvas? If you're the designer, you're the person going in, how do you create the canvas then where the community can come in and use pop-ups and different things to understand who they are before the permanent fixtures are put into place? So really allow them to have that authentic voice and genuine participation, not just a token, yes, we talk to the neighborhood.
I've done a lot of interactive charrettes and community planning things in my life. And there seems to be a connection to the types of places people inhabit and their willingness to um, self-produce, roll up their sleeves and take control of, I've been in these where as a professional you show up and they're really quiet and I think maybe intimidated to have an opinion on what this place should be and what needs to change. And you can kind of take a temperature of the room and say, okay, this is where they are in their evolution as a neighborhood or a community. There's other places I've walked into and, they got opinions. This is what I think we need to get done. And you're here to help us, but we want to be in charge of this, the trajectory of our community. How do you think you best gauge that or predict where they are relative to the place that they're currently inhabiting? I mean, I think tokenism in some ways is this kind of sloppy gray area where we pretend to tell ourselves we're listening, but we're really just checking boxes because it's complicated, it's tough. But the other side of that spectrum is you run the risk of going in and telling a community how to fix something that they don't think needs fixed, which I've seen countless times. So how do you balance that? And what do you really call that? How do you prioritize that? Is that fall into this discussion of production and people just aren't used to having that role in a public setting?
That's a really good question. The first thing that comes to my mind is what are the skills and tools you're taking into the process? If as the as the design or as the design professional, if you're only going in with design skills, then you're probably going to listen with the intent of responding to your community and checking the box rather than listening with the intent of understanding who they are and how they want to function in that space. And if there are some tools that maybe we can help move past, so you develop authentic relationships when you first go in. So you don't necessarily go in with your pads and your designs per se to look at the space, but you go in and you gauge the culture and how people are already interacting and who they are. And those are a little bit different tools than you would use if you went in. And I'm not saying there aren't times that going in directly with design thinking and design tools is the right thing. There are times when that is the case, especially in new communities or places where you want to create things that maybe people choose to come to rather than people who are already living there.
Right. And those are very different things.
They are very different things. And unfortunately, a lot of the gentrification comes when you go in with your ideas and you want to create a place that maybe isn't a fit with the people who are currently living there.
How do you think this maker mindset prioritization of production changes how these communities think for themselves?
I would like to say each of us wants to feel valued. We want our ideas and our thoughts to be recognized and incorporated into pieces. And if we feel that we were heard and seen in these processes, and a piece of us is reflected in what is created, maybe because we were actually the ones who planted that tree or who came up with the idea of putting a series of benches over there so we could sit and have conversations. If when we see ourselves reflected in that, then we also want to be the ones that make sure it's kept up and it looks nice.
Right.
And so it's really a crowdsourced kind of thinking. We have so much that we have to accomplish. We have so many changes that we need to make, and unless we get everyone involved, the likelihood that we get to where we need to be is going to be very limited. And we only have limited amount of funds too, so you can increase your production opportunity really greatly if you bring that core economy in. You say, you're going to live here and use this. Maybe if you come over next week, we'll spend 4 hours working on this piece, and I'm not going to have to contract it out to a builder. So we're going to save $15,000 that we can put elsewhere in our thinking. And so it's not as nice of a experience if you're the one who would normally get paid to do the work. It's a different kind of experience. But we have to keep in mind too, I know I just ran into a situation where I'm working on a makerspace in Muncie, and we have an architect helping us. Well, in the end, we paid him half as much as our full-time employee last year. So it's kind of difficult to think, wow, I understand that what you're doing is really valuable, but for the cost of some of that, we can go out and hire 3 people to do this over here for 6 weeks. And it's just another way to think about all of it. We really tend to want to place it in the market economy and the exchange of goods and services. But until we step back and also place it in the core economy, the economy where you're a neighbor and a community member and a parent, and we want this because our lives are going to be better addressed because of it. It has to be a nice fit between those two if it's going to be a sustainable model.
Sure. I'm a big proponent of the idea that the optimal currency for the human species is cooperation. And I tried to think through and put holes in my own arguments based on whether or not this increases people's ability to cooperate or reduces it. And to me, the first thing I thought of when you said that was, I think the growing preference for specialization has limited our willingness or need to cooperate. I can go hire somebody to solve this problem. Could the 3 of us figure it out by ourselves? Probably. But the responsible thing is to go hire an expert. And that's what they do. And, architects come in and that kind of thing. And to me, that is kind of, those two things are in opposition of one another. That the more flattened the economy gets, the more easily accessible these specialists are, the more difficult it has become in these communities, especially at the grassroots level, I think, to encourage or even legitimize the benefit of cooperation. So this idea of tokenism was really smoke and mirrors to pretend like we're cooperating from a specialist.
True.
Right? And that idea was to scratch that itch that we know we should be cooperating, but we also feel like we should hire a specialist to help solve these problems.
And there's a good reason for that too. I'm not negating that.
It's a give and take. There's tension there.
Yeah, and I've learned so much in the process. I mean, I understand that there are policies in place to protect people from some of the building practices that might not be
Sure.
safe, and those kind of ideas. But those also limit the neighborhood's ability to do something on their own, or and it's in everything. It's not just building. I mean, I'm amazed in Muncie how many regulations there are around trying to get a food truck started. So how do we find the right fit of the expert on the community, the people who are living there, the expert on the processes, getting the permits built, pulled and the right things to do, and then the experts on the design, and allow them to all be these boundary spanning leaders where we are experts and we come in and we work together to really make something that's really unique and special, because we're listening to each other and we're understanding where we can go.
Do you have a sense of, within the conversation of social determinants of health, which one of those indicators do you think are most negatively impacted by this inability to cooperate and produce and engage?
So when you think about the determinants of health, there's no one definition of, nobody says, oh, these are the list of
Here's
them.
the three.
Some of them are economic, some of them are social, just like anything else. It's a very broad explanation. But everything that I have studied, it goes back to those connections. So not only are you connecting with these groups that we talked about, the expert on the community, the expert on the design, and the expert on the process. I mean, those are really important connections that can move other projects forward too. And quite often, all three of those might live in the neighborhood that's working on a park. So it's not like they're not also experts on the community. So those connections are so valuable. And there's a process we're looking at called Web of Support, where you need at least 5 anchors who are throwing you tangible things that you can catch, like money and courage and all these things that can help you continue to grow and be willing to take risks. So you're more confident in embracing the uncertainty of the future, because you're surrounded by these people who are on this journey with you to stay connected so we can keep it moving forward and look at something different.
How would you, with all this research and analysis that you've done in placemaking, what's the advice you give to a new mayor? What when you think of the leadership of a community, I'll pick on the mayor, but is there a singular bit of advice where you'd say these are the things that you really probably need to better understand, or you likely underappreciate?
That's a really good question. I actually talk to our mayor pretty regularly. I'm happy to say Muncie was just recognized as an All-America city.
Yeah, I saw that.
So we're very excited about how well we've done in bringing citizens together to move health and well-being projects forward. And, our mayor recognizes that the people are a valuable tool. We recognize that neighborhood associations can become strong and really make a change in the neighborhood that matters to them. And you have to listen to that. You have to bring the people along with you. I read a story, and I can't even remember which author I was working with, but he talks about a mayor in Canada that's been the mayor for a long time. And this guy was out interviewing them, and they were walking down the street, and 2 of the citizens came up to the mayor and said, "We need to do something about this." And the mayor said, "That's a really good idea. Who else needs to be involved?" So they brainstormed. He said, "Get the 5 of you together, and I'll meet you in City Hall on Friday at 4, and we'll make this a city project." So, but it was a city project that those 5 people were going to move forward, not that the city was going to move forward. So really empowering your people to take action on the things that are of value to them and that they love, and I think can be a really meaningful opportunity. And then making it saying, you're going to meet in City Hall because you're really part of what this is, gives them that feeling of being empowered and valued.
My favorite part of that story is they run into the mayor on the sidewalk.
Right.
And I think there's something to that. And my gut is that we get asked a lot, and I'm sure you do too, about what are some prescriptive strategies my community could do without telling me anything about their community. Just what could I be doing? And what I really think the problem here is the answers aren't sensational at all. If I could just say you need to bump into more people more frequently, uh, no one would like that answer. But I fully believe that's one of the best answers you could give to that question is that the more you're bumping into people you kind of know until you really know them is a really powerful strategy of building a community. But that's really hard to say on a political stump speech or put any real tangible policy to that in any real way. It feels like the only way to really do that is to try to educate people that have the willingness and capacity to lead at the local level to understand this. I grew up. I always tell the story in a real small town in Indiana, uh, in a lot of ways run by a couple of Franciscan nuns who just bossed people around and did whatever they said because they had a habit on. And that gave them some sense of power and control, especially over me, because mom said, "Listen to Sister Teresa." Uh, but she was going around saying, go shovel that person's driveway, go rake those leaves. And you just said, "Yes, ma'am," and you did it. And I met all kinds of people doing those kinds of chores. And there was no program, there was no incentive. No one told her that she should engage the youth. Like it had nothing to do with that. She knew something had to get done, and the community needed somebody to step up. And she had some control over some people with strong backs and a shovel. And I think that the problem is the prescriptive answer is it needs to be organic, but you can't prescribe.
But you can create the conditions where that can emerge by creating different
that
ways.
is the placemaking part, right?
Yeah.
I mean,
Yes and no. I think as designers, you can think about what might create people to linger in different places.
yeah, yes.
And there's actually a theoretical, a physics principle called adjacent possible. So I know, I know what I know, and you know what you know, but I don't know what you know. And a lot of it is completely outside of my realm of even understanding. But now, because I know you, I also have the adjacent possible of what you bring into our relationship. And as just like the nodes, designers think about nodes and creating
Right.
these nodes. And how do we think about that socially as well? How can we create a space that might encourage two people walking down the street to stop for a minute and have a conversation? And that changes everything because now there's an adjacent possible that wasn't there before. So I think, and I think sending people out to meet people and do things for people is also a way to connect. I mean, because you met some of those
Right.
neighbors and you didn't just go shovel their driveway. They usually would have probably came out and gave you some hot chocolate or,
Right.
they did things that allowed you to connect in ways that we don't do anymore. And that's okay. We live in a system that creates the conditions that we're experiencing. That's why I say, back to Halbert Dunn's work, functioning optimally in their current environment. I think we are. I just think our environments aren't very good.
Mm-hmm.
And there are reasons that our environments aren't good. It's because we now have more likely to have two working families. So you don't watch the neighborhood and get to know the neighbors. There are so many things that have contributed to us getting to where we are now. And we're not going to change it overnight, but we can start nudging some things in the right direction that allow us to reconnect as people and move things forward differently because we're thinking about our neighbors and we're thinking about our coworkers and we're thinking about the folks down the street as well as what we want out of the world.
Jane, I could do this all day, but thank you for doing this. And maybe we'll figure out a way to do it again. but I look forward to seeing what you're going to do here in the future. And I really appreciate all the work you've done.
Well, and thank you for giving me a platform to be able to share my voice and share my stories. I really appreciate it.